What is accessible medical equipment for ADA healthcare compliance? Imagine walking into a healthcare facility and knowing that every piece of equipment is designed to include everyone. That's the goal of accessible medical equipment. It refers to devices made or modified so people with disabilities can use them easily, either on their own or with minimal help. This is a key part of making healthcare fair and equal under the Americans with Disabilities Act. The ADA says healthcare providers must make their services accessible to all patients. That means providing equipment that fits different physical needs. These devices must follow specific standards to be truly usable by people with mobility, sensory, or other impairments. Some common types of accessible medical equipment include examination tables and chairs that can change height and position. This helps patients who use wheelchairs or have limited movement transfer safely and comfortably. Weight scales that can handle wheelchair users are also important. These scales allow patients to stay seated in their wheelchairs or have transfer supports to get on the scale easily. Imaging devices like mammography machines and X-ray equipment are made adjustable so patients who cannot stand or need to sit can still get their tests done. Dental chairs that can be lowered or adjusted help patients transfer smoothly and stay supported during dental procedures. The U.S. Access Board has set standards for this kind of equipment. These standards specify how devices should be designed and operated. They cover things like patient positioning, transfer supports, operable parts, and communication features. This helps ensure patients with disabilities can use the equipment independently or with little help. Healthcare providers that receive federal funding, including Medicare and Medicaid, must follow these standards. They are required to have a minimum of 10% of their equipment accessible, increasing to 20% in certain specialties like physical therapy or orthopedics. Some of these requirements are set to take effect as early as July 2026. When healthcare providers buy new equipment, they should choose accessible options whenever possible until they meet the required ratios. Having accessible medical equipment is vital for removing barriers to healthcare. Without it, patients with disabilities might struggle to get routine exams, diagnostic tests, or treatments. This can lead to poorer health outcomes. Making sure equipment is accessible supports the broader goal of inclusive, fair healthcare. Facilities should evaluate their current equipment to see what is accessible and what needs upgrading. They should plan to buy more accessible devices to meet ADA rules. Staff training on how to use this equipment and assist patients is also essential. Recording patients' needs for accessible equipment in their medical records helps ensure proper accommodations during visits. Overall, accessible medical equipment is a key part of making healthcare fair and welcoming for everyone. It helps patients with disabilities receive the care they need and deserve.